remark further on the legislation that's before us. Good afternoon, Senator Berthel.
Good afternoon, Madam President. Madam President, I rise in strong support of the legislation. This has been a concept, an idea that I have personally advocated for since I myself was a recipient of bariatric surgery services a number of years ago. I'd like to just take a moment, if I may, to thank the committee for raising this bill and the concept. I'd like to thank the good chair, my friend Senator Moore, for supporting this legislation as well. I'd like to thank the many advocates in the medical community. We've seen over a number of years, and this year was no exception, some very strong support in the public hearing, in written testimony for the need and requirement for the need and necessity to put expansion of the coverage of bariatric and metabolic surgery and prescription drugs that are used to treat this disease into law. I'd also would like to acknowledge, as Senator Moore did, the many, many patients and families who testified on what I think was our longest public hearing for the Human Services Committee this year. And as the good chair spoke to, the bill does expand coverage and allows access to these services to more residents in Connecticut. And I think this is an additional next good step in getting to the ultimate goal of providing this coverage under the Affordable Care Act and through private insurance. And I think this is an important step in acknowledging for this legislative body, and hopefully the House will take this up and pass this bill, and it will get to the governor's desk and he'll sign it, because it's the right thing for us to do. Obesity is a terrible disease, recognized as a disease by the Centers for Disease Control. A lot of people think of obesity as a lifestyle problem, that people choose to be overweight. And the reality is that science will show very clearly that obesity is an addiction, not unlike the addiction that someone might have to various substances, alcohol, drugs, whatever it may be, tobacco. So this body recognizing through this legislation that obesity is a disease and that we have an opportunity to help people get treatment for it is very important. It's an important and good next step for us to be doing. We also saw through the last 24 months, 26 months of the COVID-19 coronavirus pandemic that, and our doctors that testified in favor of this bill and in support of this bill spoke to that COVID patients who were diagnosed with morbid obesity actually had a much higher mortality rate during the pandemic, which is just terribly, it's very sad to hear that this was the situation when we have good medicine and good science that can help people to be cured from morbid obesity. We also learned from the medical community and their science and their study of the data that people of color suffer outside of COVID and even through COVID with more comorbidities. People of color who are obese end up more sickly as a result of their obesity. Metabolic and bariatric surgery, along with these pharmaceuticals that are covered in the bill, can and will help to cure this disease. And I don't have any questions, Madam President. I've been a strong advocate. I urge my colleagues to support the legislation. Thank you very much.